Hi, I am Apurv Sinha, consultant trauma and orthopedic surgeon with special interest in hand, wrist and shoulder and elbow surgery. In today's video, we are going to discuss arthritis of the base of the thumb and treatment options for it, including surgery, which is a trapeziectomy procedure. As arthritis affects any other joint in the body, it can affect the thumb as well. And it's one of the most common joints to have arthritis in because it's so frequently used. In osteoarthritis of base of the thumb, symptoms typically are pain and discomfort just at the base. Movements of the thumb are uncomfortable and painful. Gripping of anything is also uncomfortable and painful. In mild to moderate disease, this pain and discomfort is infrequent. As the disease progresses, it becomes extremely uncomfortable even to do routine daily activities. The thumb can also start looking slightly misshapen, and the base of the thumb, which is the metacarpal bone, can start moving out of its place, which we call subluxation. This can lead to extreme weakness in grip strength and lack of proper full use of the hand. If we look at this X-ray, trapezium is the bone which is present next to the metacarpal of the thumb. This forms the CMC or the carpometacarpal joint and the STT or the scaphoid, trapezium and trapezoid joint. In base of thumb arthritis, there is arthritis around the trapezium bone. In this image, we can clearly see a normal X-ray as compared to an X-ray with arthritis showing ossified formation, reduced joint space, sclerosis and all the typical features which we see in osteoarthritis. The treatment options for osteoarthritis in the base of the thumb start from simple measures like taking regular analgesia, using a splint to support the thumb while doing any activity, modification of the activities and avoiding any strenuous work with it. For very severe symptoms, we can try injections initially. These injections can either be given in clinic or they can be done under X-ray control in theatre environment. If all these non-operative measures have been tried and still we do not get symptomatic relief or the disease continues to progress, there are various surgical options available. We are going to discuss one of these surgical options, which is called a trapeziectomy. Trapeziectomy procedure, as the name suggests, involves taking the trapezium bone out around which most of the arthritis is. It can be done on its own, but usually it is augmented with a capsular repair or reconstruction to support the base of thumb. The tissue around the base of the thumb and the capsule can be used for this repair. In certain cases, when this is not sufficient, or if it's the surgeon's preference, we can use part of a tendon in the wrist called the flexor carpi radialis tendon to loop around the base of the thumb and provide more support. This added procedure is called the FCR sling procedure. The procedure is usually done as a day case under either a regional anesthetic or a general anesthetic. The incision for the procedure is usually given on the volar aspect, as we can see in this image, or it can also be given on the dorsal or the top of the thumb as well. Following the procedure, the hand is supported in a bandage which gets converted into a splint which is made by our occupational therapy team. It's important to look after your hand after the procedure, mainly elevation of the limb for the first few days to avoid any swelling, movement of the fingers and the thumb to prevent any stiffness in it. The big bulky bandage is converted into a splint to support the base of the thumb which has recently been operated, and this splint stays in position for few weeks. You are seen by the physiotherapist and advice is given on exercises of the thumb to improve the strength in it. It takes good 4 to 6 weeks time to resume routine daily activities, but it can take few more months to get to a level where you can do physical work and manual work with this thumb. As with any other procedure, there are risks associated with trapeziectomy as well. These include risk of anesthetic, either regional or general, small risk of bleeding, infection, scar tissue formation in the region, pain and discomfort in the base of the thumb, complex regional pain syndrome, a slight weakness in grip strength, which is noted especially in someone who does a lot of manual work. In a small proportion of cases, even after doing the trapeziectomy procedure, there continues to be quite significant discomfort and pain in the base. For more information, please visit our website, and you can ask any questions that you have when you see us in class.